Hey, it's Dr. Christine. Welcome. This is Change Your Mind, Change Your Life. This is your home for learning how to put an end to chronic pain and chronic symptoms. When you come here, you're learning how to rewire your brain. You're learning how to interrupt the neural circuit, the neural loop that has been locking pain or symptoms into place for you. So welcome. Very glad that you're here. All right, so you've probably heard of the placebo effect. The placebo effect is when a person perceives some sort of positive benefit after being given either a pretend medicine or having some sort of pretend therapy applied when the thing is actually inert, meaning the thing really actually doesn't do anything. Maybe it's a sugar pill or a compressed pill of baking powder, or maybe it's some sort of a pretend treatment to the surface of the body that really is not therapeutic in any way. So that's the placebo effect, and I'll probably make a future video about this, but it is incredible what common things really perform no better than placebo. To give you a little bit of a hint, it's some very common prescription medications and even surgeries. There are some surgeries that perform no better than placebo. Okay, so anyway, that's another video. But today I'm talking about the nocebo effect, and you maybe never have heard about this before. The nocebo effect is essentially the opposite of the placebo effect. And the nocebo effect plays a big role in chronic pain or other chronic nuisance symptoms. And let me explain. So a placebo effect means the person's been perceiving that they'll get a benefit from some sort of inert or useless substance or procedure. The nocebo effect means a person is expecting or perceiving some sort of a negative consequence, a negative effect. And this might lead to a person having perceived side effects from nothing more than a sugar pill. Maybe they claim it upset their stomach or gave them a headache or made them feel sweaty or anxious. Could be anything. So in other words, the expectation of certain negative effects can actually manifest those negative effects, even in the absence of any true cause. And the perceived cause is inherently harmless. So this highlights how powerful the mind is when it comes to chronic pain and chronic symptoms. Because quite often with chronic pain or with chronic symptoms, our brains build associations. Our brains are so good at doing this because it's a protective mechanism. We associate falling down with jumping off something high. Well, that can keep you alive. It's going to stop you from jumping off of a cliff, right? Or we associate pain with touching a fire or touching a hot burner. Again, this is going to keep you alive, and that's a good thing. With chronic pain or with chronic symptoms, these natural survival instincts just get a little skewed out of balance. And things that are inherently not dangerous, whether it's the conscious mind or the subconscious mind or both, begins to perceive non-dangerous things as dangerous. And here, be honest with yourself. Do you either perceive some of these things as dangerous, that I'm going to list in just a moment, or do you avoid these things because you think that they will trigger pain? Things like bending over to lift something, turning the head, sneezing, going to the bathroom, riding in a car, going to public places, going to open places, going to crowded places, eating certain foods, eating dairy, eating gluten. In the absence of a true demonstrable medical condition, these things are not dangerous to you, but either your conscious mind and or subconscious mind have created a faulty association, misinformation, and believes that they are dangerous. Now, this is the nocebo effect. And so if you sneeze and you're struck with sudden back pain, neck pain, if you go to a crowded place and you feel tightness in your chest, like you can't breathe, like you might be having a heart attack, if you go to a wide open space and it brings on dizziness and your lack of equilibrium, these are things that your brain has miscalculated, caused Your brain has created an association based on misinformation, and then it's acting on that information. So by acting on the misinformation, it's triggering your body's fight or flight system. It's doing its best to get you to stop doing what it feels is dangerous, or to get out of where you are because it perceives it as dangerous. So this really boils down to the nocebo effect, which is related. It's the flip side of the coin of the placebo effect. So I just thought I'd give you that little lesson today. And again, just to hammer home what was really going on is through misinformation and fear, your brain has created a loop, a neural circuit loop between brain and body that is giving you symptoms. The brain is very good at imitating actual conditions, and that's why these symptoms grab your attention. Hey, the brain just wants to keep you safe and keep you alive, and it will do whatever it can do to ensure that that happens. Unfortunately, its very good intentions went a little bit overboard. But that is okay, because by being here, you're learning how to dial that down step by step. The most important thing you can do is to watch each video. I put out several videos per week. They're very short because the most important thing you can do is little by little by little, with consistency and over time, retrain, rewire your brain. Your brain did not get this way just in a day. Your brain, whether you had symptoms as a child or not, your brain laid down the foundation to experience chronic pain and chronic symptoms today. It got laid down years, even decades ago. So this, hey, some people do listen once or twice and have remarkable reduction of symptoms. Other people, it's little by little by little. But the most important thing you can do is take in this message gradually, with consistency, with repetition, and staying true to it. All right, my friends, thanks for being here. I will see you in a couple days at the next video. Take care. Bye-bye.